Thank you for tuning in to our Lymphedema Can't Ruin My Survivorship webinar. I'm Dr. Sheri Prentiss. I am your host for this conversation and the founder of the Live Today Foundation, a 501c3 nonprofit organization where our mission is to provide joy, inspiration, and free compression garments to cancer patients and survivors living with lymphedema. Now, those of you tuning in right now, I imagine fall into one of a few categories. You're either a cancer patient, survivor, caregiver, and co-survivor. Maybe you're a clinician, maybe a physician, a therapist, a nurse. Maybe you're a patient advocate or a nurse navigator. Whatever your reason for being on today, I'm happy that you took the time to be here. Today, I have a wonderful guest who will help me continue the conversation specifically on how cancer patients and survivors can prevent lymphedema. Yes, let me repeat that. The word is prevent lymphedema as a chronic debilitating disease. Now, Sabrina Korentager earned an undergraduate degree from Kansas State University in industrial psychology, and then she went on to receive a master's of science in nursing. She has over 25 years of clinical nursing experience that includes research in cardiac and cancer research areas. It was during her cancer research that led her to what she would define as her true passion of working with patients directly impacted by cancer-related lymphedema. So she decided to return to school to become certified as a lymphedema therapist, and she has focused her attention on lymphedema prevention. Sabrina, thank you so much for joining me today, and I couldn't be more thrilled to pick your brain and to share your knowledge with our audience. How are you doing today?
I'm doing great, Dr. Sheri. And as you know, I always love being able to do this with you because I think we share such a common goal and really bring a different perspective to the conversation about lymphedema, especially when it surrounds prevention.
Exactly. Now, I know firsthand about how grueling a breast cancer, any cancer diagnosis, what that type of diagnosis could do to your body and to the mind of patients and survivors, and to those who are newly diagnosed. Now, for those of you that are part of the webinar that may not know my story, I am a 13-year breast cancer survivor. But when I was diagnosed, man, it flipped my world upside down. I had been a practicing physician for 16 years. And I was diagnosed in October of 2008. And it was invasive ductal carcinoma. I underwent a partial mastectomy, a level 1 lymph node dissection where they removed 16 lymph nodes out of my right armpit, 3 of which were positive for cancer. And then I underwent 15 rounds of chemotherapy and 33 treatments of radiation. And I was so happy to be done with all of my treatment, right? To no longer be defined in my mind by my breast cancer diagnoses. I just wanted to move on and get back to practicing to the career I've always wanted. I've wanted to be a doctor ever since I was 2 years old. I could never imagine being anything but a physician. So you can imagine my devastation when I'm ready to move on past my diagnosis of breast cancer, get back into taking care of patients. And then within a few months, I was now diagnosed with lymphedema. And my lymphedema was already stage 2 by the time it was diagnosed. And unfortunately, that happens to a lot of cancer patients. They get diagnosed with lymphedema in the stages where it's no longer reversible. And, you know, part of the grueling experience of a cancer diagnosis is that knowledge of these possible side effects and complications, right, of our cancer treatment. And lymphedema is one of those possible devastating side effects of breast cancer treatment that can mean another battle to fight. And this has been a battle for me for the last more than 10 years. And my lymphedema diagnosis, it knocked me off my feet, turned my world upside down because it left me disabled from performing the clinical functions of my job, my career, my passion that I've wanted all my life. Now, after 16 years of practicing, now after beating my breast cancer diagnosis and going through all the treatment, I'm now left with a lifelong disease that can never, ever be cured. But as a result of this diagnosis, it's burned an indelible purpose in my heart and that is to share with the world the progress that science and technology has allowed lymphedema to be detected in its early stages, and with some simple at-home care, prevent this chronic debilitating lymphedema that has plagued my life. So, and Sabrina's going to help me explain how this happened, how can this be, and how wonderful it is to be able to now have in our armamentarium as a survivor, to take back that control of our lives and do what we need to do so that we can beat the cancer diagnosis, and then we can further eliminate having chronic debilitating lymphedema. So for you, Sabrina, you treat tons of patients. What would you say is the percentage of breast cancer patients that are affected by lymphedema?
We estimate about 20% of the patients are affected to some varying degree.
Okay. And what can happen if it's left untreated?
So left untreated, and this is where, you so eloquently described something we don't talk about. So first, the physical side effects. Physical side effects, if left untreated, it can progress to a point where you're unable to carry out your just general daily living. Maybe you can't work. I always talk about one of my very first patients was an accountant, that her hand could never be controlled with the swelling. So she had to give up being an accountant. That was not only her passion, but her way of supporting herself. It can also, even low levels of lymphedema can interfere with daily activities. Like if you like to be outdoors in the heat, or you like to go swimming, or you like to do certain activities. So that's the physical side effects that can progress. Certainly chronic lymphedema left untreated can progress to chronic infections, cellulitis, hospitalizations, lots of things such as that. But I also have recognized, and you mentioned this when you said this is why I got into it, I think there's a bigger component, and it's the psychological component. We overlook that sometimes. I got into this because I met a lovely patient when I was doing research that I really didn't know anything about lymphedema. And she asked me, she said, do you know really what I hate about having lymphedema? And, I was kind of like, what? And she said, I can't get away from the fact that I had breast cancer. And I thought about that. And she said, I'm a 2-time survivor of an aggressive cancer, but daily I'm reminded that I had cancer. Not only that, comes the components of being in public, having people ask questions. Maybe you don't always want to share your story, but people sure want you to when you look different. And so it becomes a bigger issue sometimes with having a good quality of life because you have this lasting effect. So I try in my clinics to really, when we talk about prevention, say we're trying to really prevent both of those things, not only the physical effects, but the psychological effects.
Man, you hit the nail on the head. And listen, everyone that is tuning in, I'm asking Sabrina questions, but I'm sure I won't ask her the questions that you may have. So please feel free in the Q&A section, put your questions out there. We will definitely address your questions at the end of the webinar. We've allowed plenty of time to get to your questions. So put your Q&As out there on the Q&A section so that we can continue the conversation. But Sabrina, you are absolutely so right. And it's refreshing when you and I came to know each other. It was refreshing to hear you explain and expound on the psychosocial impacts of lymphedema, because again, I'm a physician and my fellow physicians, we weren't having those kind of conversations. Many of them thought that I had a burn. Many of them thought I was treating carpal tunnel. I mean, you'd be surprised. And so I realized that even amongst physicians, there needs to be more conversation, right? And physicians need to better understand the psychosocial impact so that they can now refer patients and get them the additional resources that they need. Because I can tell you, I was thoroughly embarrassed, not so much because of the garment. Now the nude ones I was, when they say nude, I've treated thousands of patients and I never can match a nude color to the particular nude in our garment, right? And so I've always chosen, gray or black or something to stand out. Make a statement. I'll bling it out, right? But that's because I'm a physician. That's because I am an extroverted introvert. So if I can do something to educate and bring awareness, then I will bling it out and try to draw attention so that when questions are asked, I can help educate and well inform. But everybody's not like that, right? No. And so when you're going out to dinners and you're passing past those hors d'oeuvres and you're trying to determine, well, do I try to hold a cocktail or do I try to grab a shrimp?
Right.
But your fingers don't move necessarily the same way. So I so appreciate your appreciation for the psychosocial impacts that you just don't have a clue about. You can know how to diagnose it. You can understand and know how to treat it. But until you empathetically try to put yourself in the shoes of someone and appreciate what they're going through, you're left not complete, not complete. And so advanced lymphedema requires lifelong management with treatments and products and therapies that are costly and time consuming. Can you describe some of the treatments, some of the products and therapies that patients may have to endure with this disease?
So again, from mild to severe lymphedema, there's a range of interventions and products. One thing I always make a note of when we talk about this is most are not covered by insurance. So you also then have not only physical, psychological, now you have financial ramifications, which just make this a whole ball of wax that for some patients, it really makes them angry. I work with a lot of patients that are angry about having to have treatment. And so some of the basic treatments are using compression sleeves, compression garments as you have on. There's nighttime garments. There's also, treatment, what we call complete decongestive therapy, which is by a specialized occupational or physical therapist that you actually have to go somewhere to have done either several times a week or on a monthly basis, depending upon where you're at. Again, I mentioned some of these patients' treatment may include being hospitalized because they get chronic infections. Most of the time for, severe cases, these patients may be wrapping at nighttime, bandaging. They may be spending an hour or two a day just maintaining. I actually, I thought about whether I was going to share this story or not today, but I actually worked with a woman just this week who was really frustrated because people had been labeling her as non-compliant. And when I spent some time with her, she was frustrated because she says, I'm spending all these hours of my time and nothing's getting better. And I said, you're not non-compliant, you're frustrated. And that's really what we see. Patients want to do the right thing, but they spend so much of their time that takes away from their family, from their jobs, from doing things that they want. And sometimes it's not making things that much better. And so again, that philosophy goes in with the whole prevention. If we prevent this or lessen the degree of it, then we can help with this financial burden. We can help with this emotional burden and certainly the physiological burden.
Yes. And on all three of those burdens I experienced,
they're
which
significant.
led me to start the Live Today Foundation. I did not have the assistance getting compression garments through my insurance company. And the more
they're expensive
and
necessary.
Custom garment, forget about it, right? And there are no resources. And I saw so many women, one who were untreated because they were told that it was just some swelling.
Or just a side effect.
Yeah, just a side effect.
Just deal with it.
Don't worry about it. At least you survived, right? That favorite saying.
Yeah, that tends not to be my favorite.
Yeah, no, not at all. Not at all. And so that was the premise of the Live Today Foundation. Some kind of way we have to be able to provide compression garments, which is the mainstay of treatment, right? For those under-resourced cancer patients and survivors living with lymphedema. Your patient was so right. You can never forget your cancer experience. Every single time you're donning this garment, it is a reminder of that whole cancer.
It's insulting.
Experience. Yes, exactly. And then you can go through the treatment. I went through everything. I had 4 months of physical therapy, 4, Monday through Friday, taping and bandaging and wrapping and taping and bandaging and wrapping, the whole 9 yards. For 4 months. And after the 4 months, I was still relegated to wearing compression garments 24/7, my daily wear, and then my big oven mitt that I wear at night to sleep in. And so it's just constant. It's unrelenting, right? And
maintaining.
Yes. And for me, I did have to change my career. Right? I did all my life. All I did was train, study for, and go to school to be a physician. And then to have that stripped away really left me feeling less than whole. It caused me to have to reevaluate my value. It caused me to have to take a step back and choose to focus on what still remained rather than what I've lost in order for me to reinvent myself. Thankfully, I had the education, I had the resources, started my own healthcare consulting business, and became a professional speaker. Everyone does not have these types of opportunities available. Hence, why webinars of this nature and getting this message out is so extremely important. So now that we've covered what living with chronic lymphedema could look like, I want to shift the conversation to the new and exciting,
my favorite topic,
of detection and prevention. Okay, so how I wish this form of detection and prevention had been available to me when I was diagnosed. But using simple and accurate monitoring, a patient's clinician can detect lymphedema early and intervene effectively. Is that correct?
That is correct. There's technology called LDEX, which is available on SOZO, that has been shown to be effective, reliable, and accurate in detecting lymphedema, usually before there's even physical symptoms, which that in itself is the word what prevention does. We know this from several studies. There's been a multi-center study that showed that using LDEX or SOZO on the SOZO platform was effective at reducing the onset of lymphedema by 95% in patients. In my own institution, we published a study in late 2018 that had a lymphedema rate of 5.6, and this was of the very highest patients that had undergone axillary dissections coupled with taxane therapies and radiation. So we only selected the very highest patients of risk factors to do, and we ended up with a 5.6%. Of that 5.6%, only half of them had a stage 1. Meaning when we talk about prevention, we know that we can't prevent every single thing. But if we can lessen, as you mentioned, yours is a stage 2, if we can lessen and have these much smaller levels, they're much more manageable. And so not only did the initial research study and then our own show this dramatic lessening of the onset of lymphedema, the rates that people got it were much smaller and more manageable. So we know that this reliable, effective type of monitoring, when coupled with at-home interventions, works, because our patients, when we detected, and in the study too, when there were these subtle changes detected, we gave them at-home interventions. We didn't send them out for expensive treatment. We didn't send them out some other place. We used at-home regimens of some compression and maybe massage and other things. And so we know that early detection works.
Perfect. Oh my God. I'm so.
I see it every day, and it's always exciting.
Exactly. Because when you think of the millions of individuals that are affected with lymphedema now, right? They're affected. And thankfully, we have some wonderful partners out there. They make some fantastic compression garments. They're revising and coming up with new treatment modalities. Every day, right?
Every day.
Thank God, we now have something where hopefully when we're talking, 2-3 years from now, instead of having more newly diagnosed lymphedema patients, we have less and less and less. And that is what we are shooting for. But we got to get the word out there. Individuals have to understand and know what lymphedema is. They need to understand what they can do to prevent it. They need to understand what to do to monitor it. And they need to appreciate that it is not just some swelling. Now, I am super excited because we already have like 9 questions in the queue.
I see that.
I still keep putting the questions out there. We promise you we're going to get to them because we only have a few more minutes of some questions that I really want to make sure I ask Sabrina. Whenever you have the opportunity to have a beautiful expert like her, you want to try to get it all in when you can. So based upon what you stated, it is extremely important to get tested.
It is.
Getting tested now, you can detect it at the earlier stages, right? So
correct.
Once a patient receives their baseline LDEX score, is regular monitoring important for the early detection and treatment?
Regular monitoring is very important. And it's important that you find a place that understands that this is designed not to be a one-time thing. Remember, I mentioned that it's designed to catch it before physical symptoms start. You mentioned in your own story, it was kind of, well, now you have it, you're done. And historically, that's what lymphedema has been, is, well, let's wait and see. And if you get it, you get it. The LDEX is designed to show you these subtle changes before the symptoms happen. And if you're not doing regular testing, how can you know that? If you're waiting until symptoms are present, then it's not always too late, but it's certainly not as easy or effective. And that's one of the things in prevention we really hone in on with our patients is, listen, prevention means before. Prevention doesn't mean after, it means before. So finding a physician or a provider that has this ability to do early detection and then do it along a continuum at key intervals, whatever is appropriate for your risk factors, then I think that's really key in the stages of prevention and in the early detection. It's only as good as how much you're using it and how you're using it.
Exactly. So as a patient, I would assume that it's important for me to understand and know whether or not my physician, the institution where I'm going, if they have a lymphedema prevention program, or what do they do to monitor early stages of lymphedema in order to prevent me from having chronic debilitating lymphedema. So that's a question.
Correct. It is a good question. You know, I'm sad even to say in the year 2021, I meet patients who have never even had a conversation. You know, I understand not every patient has access to this technology, which is, as you know, is my goal. I think this should be standard for all, but I recognize I work with a lot of rural patients, and I'm amazed at the amount of patients who've never even had a conversation about prevention. And I don't want patients to come away with a message that they can't do anything, that this has to be an all or nothing. Every place that you receive cancer treatment should be having conversations about prevention. What does early lymphedema look like? What does it feel like? And how can we educate patients to be able to be, you know, it's pivotal to their care and be their own advocates? I don't want them to wait and see, because that's a really uneasy feeling. So I think every program should have some framework of a prevention program.
Absolutely. So in summary, I want to make sure that everyone is following along. So if you're a newly diagnosed cancer patient, or even if you're a current cancer survivor and you haven't noticed any swelling, one, ask your doctor at every level, whether or not it's the breast surgeon, it's the medical oncologist, it's a radiation oncologist. Ask a clinician on your team if they participate in a lymphedema prevention program. And if not, we're going to give you some resources of where you can go to find out where you can go and initially get tested. And then with regular monitoring, your clinician can detect when the early reversible changes of lymphedema have occurred, which serves as a trigger, right? And at that point, they can intervene with some simple at-home care and get treated. So your 3 T's to remember: get tested, it'll trigger, then you can get treated. And with the proper intervention, chronic debilitating lymphedema can be prevented.
Absolutely.
Absolutely. So I want to jump into some of these questions because they're rolling in.
Let's see what we got.
We have enough time. So someone has stated, my doctor hasn't emphasized lymphedema as a side effect. Should I talk to him about that? Absolutely. You should ask your physician. And like I stated, whether or not, am I at risk? I want to ask the breast surgeon. I want to ask the medical oncologist, the radiation oncologist, even ask the nurse navigator. If you've been assigned a patient advocate, even ask them, where could I go? You know, maybe I should pop into the therapy department because maybe there's SOZO devices in the therapy department, and then the physician didn't even think about it, right? They're not thinking, right? So ask any member on your team. If you got to ask them about lymphedema as a side effect.
Know your risk. Every patient deserves to know their risk, whether it's low risk or high risk. Every patient should be given this information as part of their care before you have surgery.
Correct. Now we have a question from Jean. Jean says, it feels like digging for gold in obtaining a high quality garment. You can provide financial assistance for patients. Okay, so Jean, let me clarify. We do not provide financial assistance, but what we can do is if you reach out to the Live Today Foundation, shoot us an email at info@live-today. What we do is we provide compression garments for under-resourced cancer patients and survivors living with lymphedema. So reach out to us, and yes, we can help provide you with some compression garments for you and or your loved one.
So glad you do that. It's such an important thing.
It makes a world of a difference, because if you don't treat it, here's the reality. Even with the embarrassment, even with the drawing attention, what you take a risk of doing, and I saw so many women who did this, they would wear the long sleeves, and it's 98 degrees. They're about to pass, right? Or they won't get treated at all, and they just try to wear long sleeves and cover it up. Well, the problem that you run into that is that as that swelling continues to progress and get worse, you get a little cut in your hand, you get a burn on your finger. And now you're at such a risk for infection and cellulitis. And then you got antibiotics, and then you got oozing sores. And then when it's not checked and done and treated correctly, you can run into getting that infection in your blood system and end up with sepsis. So it's not something that you can live with and then just forget about it, because lymphedema will remind you. It's going to remind you, because it's going to get worse. It's going to get worse if you don't do anything to treat it. Do you want to take the next question from Bob, maybe?
Sure. Let me see what we've got here.
Well, I'll read it.
Bob says, after a diagnosis with all lymph nodes removed on the left side, chemo and radiation. You
should definitely be talking, because you have every risk factor that you can think of to get.
And Bob, I'd like to say, I actually have a lot of male patients. I think that sometimes our male patients feel like they can't speak up. So I'm glad that Bob raised his hand and said, hey, what should I be doing? Because we treat males exactly the same way. I always say, for me, and I don't mean this disrespectful, it's not so much about the breast, it's about the armpit. What are we doing to the lymph nodes? Correct. And so absolutely, I would love for you to get some information, because you should have the same risk information, prevention program, stratification, all of that as our other breast cancer patients.
Absolutely. And I'm going to take Bob's follow-up question, because he said, is there a time limit for lymphedema to show up, or are we on high alert forever? Well, even though 50% of the lymphedema, there is, first of all, 1 in 3 at-risk cancer patients will develop lymphedema in their lifetime. There's one. 50% of those individuals, the lymphedema shows up within the first 3 years. But I personally know patients who were 20 years out and poof, lymphedema shows up. And so I wouldn't necessarily say high alert, but you do need to be aware. So if you haven't seen symptoms at all, have the conversation. Ask, is there a SOZO device available at your institution? Ask about the lymphedema prevention program, become a part of it, and do what you can in order to prevent chronic debilitating lymphedema. Yes. All right, so we have someone stated, Medicare waits until a person is in wound care before covering compression garments. Are there changes being made?
We're trying.
We're trying.
I've met, and I'm sure Dr. Sheri has as well. I've met with, and I'll be transparent, before COVID hit, it had passed through the Senate. It was ready to go to the House, or it may be the other way around. Sorry. But for this to be a covered basic care of people. And then when COVID hit, it got tabled. And so we're kind of back. I've met with both Kansas and Missouri. I'm in the Midwest. I've met with our legislation on both sides, explaining how this is not a quote optional type of care. This is actually care that patients need. So we are making headway. I can't speak for where Dr. Sheri is, but I do believe we're making headway. We're not there yet.
I agree. And I've done the same. I've been on the Hill for a couple of years in a row with the Lymphedema Treatment Act. And we're doing everything we possibly can in the advocacy work to get this covered, because it makes absolutely no sense. And unfortunately, people's lives are at risk over a money game, and over individuals not fully understanding and appreciating what the diagnosis of lymphedema does to an individual's and its connection. Had I never been treated for breast cancer, I wouldn't have had lymphedema.
Well, and the cost trickles down if Medicare and these other insurers, because I run into patients with, many patients are underinsured. Yes. The cost trickles down. If we could have had a basic garment then we could have probably prevented a lot of costly follow-up treatments. And so I do think we're getting there. I don't think we're there yet, but I'll tell you, those of us who work with, we are pushing as hard as we can.
Absolutely.
Every day.
Absolutely. Another question is, how do I get LDEX? Well, there's three ways. One, talk to your healthcare team, cancer care team, and see if they have a lymphedema prevention program. They may have a SOZO device already there that will measure your LDEX score. If you want to find out where SOZO devices are located and how you can get LDEX testing, you can go out to the ImpediMed website at impedimed.com, or you can go out to the Live Today website and look under Lymphedema Prevention Program tab at live-today.org. So at either website, you can get the resources that you need to find out where a SOZO provider is closest to you. This is for you, Sabrina. Can you advise how Lipoedema is similar and or different to lymphedema?
They happen, they happen for different physiological reasons in the body. Lymphedema happens because we've removed something in the body that had a job. Your lymph nodes have a job. They're there to filter, move fluids, things like that. We disrupt that with cancer through radiation, chemotherapy, removal of it. That's very different. And so I happen to specialize with that because whereas the treatment can be similar, the reasons that it happens is different. And with early detection, early detection for lymphedema is much different than lipoedema.
Mm-hmm. Excellent. Jean has a follow-up question or another question. What is the research publication that Sabrina was referring to that early detection and treatment is best standard of care?
So if you Google my name, it will come up. It's actually the use of bioimpedance spectrometry in the detection of early breast cancer related lymphedema. That's the big full title of it. And it will go over the patient population, our results, our outcomes. It will have a lot of different information about it. And so just Google that and you should find it. There's a few other publications I've done as well, but this one specifically is the one that you're looking for. It's called bioimpedance early detection of breast cancer related lymphedema.
Perfect. Christy is asking, can you give more information about your garment assistance program? Who is eligible? Is there a fee? How can they apply? Which garment manufacturers are participating? Thank you. Thank you, Christy. That's a fantastic question. First of all, there is no fee to you. Simply, if you were send us an email at info@live-today.org, we're going to list these website addresses and email addresses again, but it's info@live-today.org. You shoot us an email. You say, hey, I'm a cancer patient in need of compression garments. We send you a simple application application. Its name, what type of cancer, when did you notice swelling, something so that we can follow metrics and see where are we intervening along a cancer patient's journey, if you will. You send the application back. Once you send the application back, we send you a link so that you and your therapist can get you measured properly. And then once you are measured properly, you're also given a link to either of our partners. And both of them are well-known compression garment providers in the industry. And you pick your garment, your color, based upon your size that'll determine whether or not it's a ready-to-wear or a custom garment is needed. And then once you send us the measurements, we send them to our partners. Our partners mail the compression garments directly to you. So it really is a simple process, and we're just here to help and to be a blessing. Now, let me see, what is the next one? I have secondary lymphedema in my right leg. This is Andrea. Result of cancer. Is there a resource to send quote unquote used compression garments? I know there are people who have nothing, even if a little older, it's worth it. After a major hurricane a few years ago, I sent some bandages to someone. Thoughts. Now, I don't know about you, Sabrina. The Live Today Foundation we're not in a position to accept used garments. Correct. Because we cannot take on the liability of now sending those used garments to someone else and then they have an issue. So I don't know of a resource right now for garments. I know of a resource for prosthetics you know,
Correct.
individuals want
I usually tell people, and I will tell you, we get creative in my clinic all the time. But I usually direct people to like their local Cancer Action or American Cancer Society or someplace like that. Many of those local places where you reside will take those items. They'll be happy to. You won't necessarily be able to find, quote, a national place, but many local places, you know, these little smaller organizations that support patients will oftentimes take those. They may not advertise that, but if you reach out to them, a lot of times they are happy to. We've got a couple here in Kansas City that I've been able to successfully link people up with.
That is wonderful. And that was a good point. Your local cancer support.
Yeah.
Yeah, because my local cancer support group within the city within which I was diagnosed did accept a lot.
A lot of them will. You just have to check with them. And they have some guidelines about what they will and won't accept. But a lot of times a local smaller resource will be happy to take those. And it's a wonderful thing that you're doing if you're able to do that.
Absolutely. Absolutely. And that's a great question that you would even have that thought, because there's some individuals, they get done, they're so frustrated.
Yeah.
The first thing they want to do is just throw them out and toss them and not even think about how somebody else could be blessed by them. We have a question, and I think this will be most so for you, because I know my answer is I don't have any references, but do you have any references for doctors, like links or websites, et cetera, who specialize in liposuction specifically for, now they're saying lipedema. I don't know if they're talking about lipedema.
You can use it for both.
Lymphedema, yeah.
So my basic answer, and Dr. Sheri, obviously you're the physician here today. I've been blessed to be partnered with a very knowledgeable group of plastic surgeons who actually are very well researched, published, and are some of the pioneers in treatment of lymphedema, liposuction, et cetera, for that. So what I would recommend, rather than saying, do I have a reference? I don't, but what I would recommend is checking with a larger plastic surgery type of office. Plastic surgeons oftentimes are given a bad rap of, oh, they only do facelifts or cosmetic. If you find a restorative plastic surgeon, one who specializes in burn therapy, reconstruction after breast cancer, these types of things, they're going to have specialized types of things. Like I said, I work with 3 that specialize in lymphedema treatment itself, along with breast cancer patients. So that would be my advice, is you look for that rather than a specific link. You kind of broaden and look for a group of plastic surgeons who maybe are at an academic institute or more of a medical type of center, rather than a smaller place that focuses on smaller type or different types of surgery.
Correct. And if you do have insurance, before it gets too costly, go to your insurance website.
Correct.
Right?
Oh, that's a great idea.
Under, physicians, put in that in particular. And most times they're now breaking it out. Like I was looking for an endocrinologist the other day, and now they specify whether or not they're doing weight management, diabetes management, or everything. And so start there, because they may specify that they will do liposuction for lymphedema or lipoedema. And you'll know right then without necessarily stepping out of your network.
Correct.
Here's a question for you, Sabrina, for sure. Why are there so few lymphedema therapists, and how do we change it? How do we work with the Physical Therapy Association?
Well, I'm going to give you my honest answer. Lymphedema has traditionally not been given the attention that it needs in general. It's been traditionally treated with holistic medicine, not Western medicine. And so it's been on the back burner. And I'll tell you, Dr. Sheri and I, both for the last decade, have been trying to bring light to it, that this is something that absolutely deserves the same amount of treatment, intervention, and attention that every other disease process in Western medicine deserves. So I think it's not a very glamorous, again, I mentioned that sometimes treatment of lymphedema can be frustrating. It can be costly. There's not insurance for it. All of these factors lead people to sometimes, if you're coming out of school and you're thinking, well, I can be a physical therapist and work with a joint replacement, well, that has lots of coverage. You see usually immediate results. You don't have the complexities. I think, you find somebody who really wants to do lymphedema and they'll run with it. I think it just doesn't get the exposure that it needs to really get people to understand it is an incredibly rewarding field. I think we've made a lot of changes. I know at my institute, we have 4 dedicated lymphedema therapists specific for cancer. But again, it's all about how do we network and get the information out there to get people interested in changing the culture that we have facing lymphedema.
Correct. Now, how often, this is a Katuna question from Katuna Kanlon. How often do you recommend testing, and how soon after lymph node dissection? So what's your general practice?
Great. Well, I'm gonna kind of give a global answer because every institution should set up what works best for their framework, their patients. I'm going to speak specifically to axillary dissections because sentinel lymph node dissections we treat a little bit differently. Baseline is really the hard stop in my world. Having a baseline is really important. What you look like before somebody has surgery or chemotherapy or all those things is really the bane of my existence. In terms of follow-up, we do not do testing in the postoperative setting. It's not indicated. It's not helpful. And so usually what I do is I look at a patient's risk factors. What other things have happened with them? Do they have a lot of nodal positivity? Are they having chemotherapy? Are they having radiation? And I set up something that may look like every 3 months, may look like every 4 months. It depends upon the patient. It also depends upon, are they starting to have these small changes? If I'm noticing changes that I'm not comfortable with, I'll see them a little bit more frequently. So it's kind of a global answer, and I'm sorry for that. My answer as a whole would be, there should be a framework that says at a minimum, we test A, B, C, because we know this is best practice, and then have the ability, if a patient's needing more, to be able to step outside of that framework. So at a minimum, you should be being tested at baseline, and then sometime a few months after surgery, and then along the continuum. And so, like I said, we tend to do, 3, 6, 8, 9, 12, 18, 24 for our higher risk patients. For our lower risk, we adjust that based on need. Sometimes patients come from 5 hours away. They're certainly not going to come that frequently, but every institution should have a framework that meets the patient population they're seeing.
Exactly. That's why it's so important. Ask your cancer care team, do you have a lymphedema prevention program? What are you doing to monitor the early onset of lymphedema? Just ask that simple question. And for some of you that may say, you know what, I just don't know all the questions I should ask. If you go out to the Live Today website, I have a whole list. You can print it out, take them with you, set it in front of them and say, can you answer all of those questions for me, specifically addressing lymphedema? Jan asked, do you provide garments for primary or only secondary? At this time, Jan, we only provide garments for secondary lymphedema, for cancer-related lymphedema, not primary. We just don't have enough resources. But as the Live Today Foundation's resources multiply, which is what I'm hoping on and banking on, I'm hoping we can expand that. But right now, it's only for secondary lymphedema. Then we did this one. Oh, we have, though, let's wait on that one. Let's do this one. This is from Barbara Jackson. What is your opinion on air travel for individuals at risk for lymphedema? Do you recommend they wear compression?
I say
yes, I did.
Yeah, I do if they're high risk. I do not for my low risk patients. Low risk patients, we have found in our clinics, there is really no benefit. Those are patients having less than 10 nodes taken out. And on the pathology report, it says sentinel lymph node. Axillary dissection patients, I absolutely recommend one.
Absolutely. Absolutely wear it. Someone has asked, are there any Zoom meetings or summits like this that are specific to lipedema?
I don't know. I wish.
And I don't know. I would suggest going out to the Learn website, see if there's some additional resources there. Definitely reach out to them and see if they can come up with some additional resources. But to my knowledge,
unfortunately, I only specialize in this,
which
makes me really good at it, but not as knowledgeable about other stuff.
Exactly. Now let me see. Well, wait, we got some coming up in the chat too.
Oh.
Let me check the chat before we just do the Q&A. We have one from the okay, I think we're good on the chat. There is one, well, I don't know if there's a question, but this can occur. Someone wrote that their lymphedema presented after knee replacement.
Yeah, I've worked with patients like that. There's a nodal bed in the back of your knee. And oftentimes it's overlooked by physicians. And so what I would say, and Dr. Sheri, you can chime in on this, usually, if not always, but usually if it's related to elbow, shoulder, knee replacement, within a few months, it does get much better and clear up a lot of times. Not always. I've had some, but there is a bed of lymph nodes in the back of the knee, and it does disrupt it sometimes. It unfortunately can happen. What I would recommend is is good exercise, meaning good stretching. If you don't have a good pair of compression tights, get a good pair of compression tights, not the socks. Don't get the socks.
Right.
You need all the way up to the belly button.
Correct.
Yeah, and there is a good, like I said, my experience with a lot of these is it does clear up. It can be stubborn, but it does clear up.
Now, someone wants you, Sabrina. Someone is asking, is Sabrina seeing new patients? What is the best way to schedule an appointment with her?
Yeah, this is going to be an awful answer. I am not taking new patients at this time, unfortunately. If that person would like to get their info, I can respond to them privately, maybe about some stuff. I currently am not taking new patients. Yeah, but I do have some partners, and there's some things that we look for because we focus on prevention. So I don't want to say yes or no. If there's a way I could get their information, I can maybe talk with them a little bit more and see.
Now I want to read this one. It's a Q&A. It's in the Q&A, and I've heard this from so many people. This is why I'm going to share it. Someone wrote, 5.5 years ago, I had ovarian cancer surgery. Swelling began showing about 2 to 4 weeks after surgery. Kept asking doctors what to do. After 4 months of chemotherapy, I finally got referred to STAR program. Took another month to get scheduled to learn short bandage techniques on my toes, my feet, my legs. Wore bandages for 3 months. Had to spend thousands on compression garments, and currently spend approximately 1.5 hours a day on maintenance. I'm so disappointed in my doctors for not taking early action. I don't even know how can I get over my disappointment in them. Happy to still be alive, and leg swelling is maintained at fairly normal looking, but if I am not on top of it, my leg becomes sore, balance is off, etc. If this had happened to my doctor's mother, sister, etc., I doubt it would have been ignored. I have what's called stimmer sign across the top of my toes, which becomes very painful. I am so sorry that you went through that. And yes, I would surmise that had it been a family member of your physician, if that family member had made the physician aware, maybe the physician would have been more astute and asked further questions or got them the resources that they needed. But I can honestly say that I know of some physicians where patients may or may not complain, but if they are not fully aware of the diagnosis, what it means, what can happen, then their emotional intelligence may or may not have been at the level where you expect or have anticipated that it would be. I would like to think that that things may have gone differently had it been the family member, maybe had you been, but probably not.
Probably not.
And again, it's because that's why webinars of this nature are so important, because when you go decades upon decades of being dismissive with a diagnosis, your focus is on what's in front of you, and what's in front of that physician.
Knowledge, lack of research.
And lack of knowledge. And it's not a dismissal. It's a
lack of awareness.
It's just lack of awareness. And as a physician, even though I knew what lymphedema was, I knew how to diagnose it, when it came to me, I didn't even think to ask the question of, is there a lymphedema prevention program? It wasn't until my radiation oncologist, this is now after a partial mastectomy, after the level 1 lymph node dissection, and after 15 rounds of chemotherapy, that the word lymphedema ever came up. Shame on them and shame on me. I didn't even think to ask, because in that moment, I was a patient. I wasn't a doctor.
As you should have been.
As I should have been, right? And so now what Sabrina and I are trying to do is give you the tools that you need as a patient for you to take back that control, the control that I relinquished because I didn't know any better, because I wasn't aware, because I wasn't educated. But now that I'm educated and now that I am aware, I'm now being proactive for others, because that's what we do on this journey. What I went through was not necessarily for my testimony, but it was for me to make a difference and to make a roadway and a journey more easily traveled for others. And so now that we are aware, now that we're educated, and now that there are tools available to us to prevent this, don't leave it up to a physician. You take control. You go out to the website, you print out the questions, you take the questions to your clinician, get those questions answered. You search for institutions that have a SOZO device. You search for institutions that specifically have a lymphedema prevention program, and take back your control.
Yeah, I'd like to say, you know, her question, and I get this a lot from patients, is how can I get over my disappointment in them? I think at first you recognize it's okay to be disappointed. I have patients all the time that try and wave it off and say, but I'm alive. Yeah, but that doesn't mean you don't get the right to grieve what you're still experiencing. And that doesn't mean you don't get the right to be disappointed in a system that while you're alive and they cured your cancer, you still have a lasting reminder of it. So I think it's important to not dismiss that feeling. Doesn't mean that we can make it go away at this point, but it does mean that you can start to say, you know what, I have a right to be angry. And I have a right to be upset, and I have a right to try and process those feelings. Exactly. So please don't dismiss those.
Correct. Someone stated here in the chat, one, they wanted you to repeat the article that was referenced.
Okay.
And then one, I wasn't checked for lymphedema after a radical mastectomy. By the time I was concerned enough to request an appointment with the therapist, I was at stage 2. My oncologist's office still believes I'm low risk. How do I convince them this is a real thing?
You know, without knowing more specifics, I would say, I would ask them, what makes you think I'm not at risk? What makes you think I'm not experiencing this? I would kind of ask for clarification, you know, without knowing all of your history, which obviously we don't need to know. I would say, tell me why it's not in my best interest to receive an opinion on this, or tell me why you don't think I need this, or just ask them. They should have good rationale.
Agreed.
And I always believe if you do things in a polite manner, there's absolutely, it's your right to ask it.
Correct. Correct. If you don't have, all right. So Sabrina, I'm gonna read this. This was in the chat.
Okay.
If you don't have a good pair of compression tights, get a good pair of compression tights, not the socks. Okay, maybe someone was adding, about the men. Yes.
Yeah.
Yes. Okay, cool. All right, so we're good with that. You know what? I think we have.
It might be at the end.
I think we might be at the end.
We might be at the end.
But Sabrina, you have been, Megan, thank you so much. It has been our absolute pleasure.
Always my delight.
Sabrina, thank you so much for your time today. You are not only just a well-informed and knowledgeable therapist, but you are a wonderful and compassionate.
Oh, here, I'm going to answer this one super quick.
Oh, go ahead.
What is a good brand of compression tights? I don't recommend any one brand. I use different brands for different reasons. Here's what I'm going to tell you. It needs to be a medical brand through a certified dealer. In other words, don't order your tights off Amazon. I know that sounds silly, but go to, at least for the first time, you need to go to a place that specializes in DME, durable medical equipment, and get, there's many brands. There's Medivin, there's Jokes, there's Juzo, there's Circa, there's lots of them. And I don't promote any one of them. I use them for different reasons. But the key is making sure that you don't get one that's made for athletes, or that you know, these are medical garments designed for medical treatment. So you need to make sure that you go to a medical dealer to obtain your garments.
And before we close today, we want to put up a slide where it will show you where you can go to get more information. If you're looking for more information about SOZO or how you can find an LDEX provider, please go out to the website www.impedimed.com/get-tested. Get tested. www.impedimed.com/get-tested. Or you can always shoot them an email at info@impedimed.com. If you want to find out more resources for cancer patients and survivors, those questions that I was telling you about to ask your cancer care team, or you want to find out where you can find a SOZO provider near you, you want to find out what are the important elements to include in a lymphedema prevention program, or you or someone you know are in need of free compression garments, go out to our website for additional resources at www.live-today.org and shoot us an email if you'd like. info@live-today.org if you're in need of compression garments. Again, Sabrina, you have been absolutely fantastic. I love taking this show on the road with you.
I do too.
One day we're going to be in Greece and Australia,
We are.
Africa. This needs to hit every single continent. World. And before we leave, we have to thank everyone for tuning in today, with special thanks to Learn and InpediMed. I'm Dr. Sheri, and remember, we want you to be present, take charge of your life, and live today and every day. Take care, guys.
Take care.